Welcome to You Ask Doc About, the series where we take your most searched, most asked, and most avoided women's health questions and break them down with clarity, science, and common sense. If you watched our last episode on Pap Smears, this is the conversation that naturally comes next. If I told you that almost every sexually active person will be exposed to HPV at some point in their life, would that surprise you? HPV is one of the most common viruses in the world, and yet it's one of the most misunderstood. Today we're talking about HPV, what it is, how it affects women and men, how it leads to cancer, why the HPV vaccine matters, and why where you live, from Australia to the Caribbean, can dramatically change your cervical cancer risk. HPV stands for Human Papillomavirus. It's not one virus. It's actually a group of over 100 related viruses. About 14 of those types are considered high risk, meaning they can cause cancer. HPV is spread through skin-to-skin sexual contact, not just intercourse. And most people who have HPV don't know they have it because it usually causes no symptoms. In fact, most HPV infections clear on their own within 1 to 2 years without ever causing a problem. So let me say this clearly. Having HPV is not a sign of poor hygiene, not a sign of promiscuity, and not a moral failure. When HPV doesn't clear on its own, certain high-risk strains can cause cell changes that, over time, may turn into cancer. In women, HPV is responsible for nearly all cases of cervical cancer, cancers of the vagina and vulva, anal cancer, and low-risk strains cause genital warts. In men, HPV can cause penile cancer, anal cancer, oropharyngeal cancers which affect the throat and tonsils, and genital warts. This is why it's so important to understand HPV is not just a woman's health issue, it's a public health issue. Here's where this ties directly into Pap Smears. So Pap smear looks for abnormal cervical cells. The presence of abnormal cells is what we pick up on a Pap smear, whereas HPV testing looks for the virus that causes those abnormal changes. So that's why many countries and many guidelines are pushing or moving towards primary HPV DNA testing, either alone or alongside the Pap smears. And this is critical to understand. HPV usually causes no symptoms until the disease is advanced. No pain does not mean there's no risk. No symptoms does not mean there's no infection. So this is why screening matters. Now let's talk about the HPV vaccine, because this is one of the most powerful cancer prevention tools we have. The HPV vaccine works by preventing future HPV infections. It does not treat existing infections. It's most effective when given before sexual activity begins, but it can still offer protection later in life, even after exposure to the HPV virus. The vaccine protects against the HPV types that causes most cervical cancers, as well as other HPV-related cancers and genital warts. It has been studied extensively across millions of people worldwide and has an excellent safety profile, excellent safety record. And this is important. Vaccinating boys is just as important as vaccinating girls because HPV affects everyone. And prevention works best when the whole population is protected. Now let's talk about Australia, because it's often mentioned in conversations about cervical cancer. Australia has not eradicated cervical cancer, but it is on track to eliminate it as a public health problem. Australia's success is due to very high HPV vaccination rates, organized national screening programs, a shift into primary HPV testing, strong follow-up systems for abnormal test results. So this distinction matters. And the key takeaway here is cervical cancer is one of the few cancers we can realistically eliminate when prevention, screening, and access work together. This is not about luck, it's about systems. I want to now speak directly to women who live in the Caribbean. Cervical cancer rates are higher in many Caribbean nations compared to countries with strong screening and vaccination programs. That increased risk has nothing to do with genetics, and it's not because of personal choices. It's largely due to limited access to regular screenings, gaps in the HPV vaccination programs, delays in diagnosis, and delay in follow-up care. Too many women are diagnosed at later stages when treatment is harder and outcomes are worse. If you're a woman living in the Caribbean, here is what I want you to know. Your life is worth prevention. Your life is worth early detection. And your life is worth advocacy. Ask about screening options where you live. Ask whether HPV testing is available. Ensure follow-up if results are abnormal. If vaccination is available, protect yourself, protect your children. Where you live should never determine whether you survive a preventable cancer. So HPV is common, cervical cancer is preventable, and knowledge saves lives. If this episode helped you understand HPV more clearly, share it, especially with someone who thinks this may not apply to them, because HPV affects women and men. Vaccination protects communities, and prevention is always better than treatment. This has been You Ask Doc About. I'm Dr. Shevon Joseph, and if you found this video helpful, like and share it, and make sure that you're subscribed to our channel for more women's health info that could impact your life. Also book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealthtt.com.